We're going to speak directly to families of addiction tonight. So, if you are a parent, you are a spouse, you're a sibling, you can even be a friend or a distant cousin, but you've got somebody in your family who is struggling in addiction. Getting a reverb here.
Sorry.
You're going to want to listen to this because we're going to start challenging some of the lies that are surrounding addiction, and it keeps people stuck, especially if you've been going with this person in and out of treatment, in and out of help, in and out of taking care of car payments and bills and hospitals and maybe the legal process. It's so easy to think this is it. This is as good as it's going to get. Nothing will ever change. But if your home has been more chaos than peace, you find yourself up late at night worrying about what's going on, waiting for the other shoe to drop. You freeze up every time the phone rings, worrying about, maybe this is it. This is that call we're so afraid of getting. You've spent thousands of hours and maybe thousands of dollars trying to fix your loved one's situation, thinking, well, maybe this time it will work. Maybe this time they'll get serious. Maybe this time they'll change, only to be disappointed again, which just leaves, as a family member, it just leaves you exhausted, frustrated, hopeless, believing that you've tried everything, but nothing ever works. Then this live stream is for you. We know this personally because we are not only family members of an addict, we too are in recovery. So we've been on both sides of this deal. And for the last 20 years, we've been helping people. So tonight's not just another YouTube live. Tonight, we want to offer some hope. We're going to help you to break free from those lies that keep your family trapped. And if you're the one that's struggling with substance abuse, you're going to learn some stuff too, and welcome. But we want to help move you beyond the fear and the chaos and the guilt and this endless cycle of addiction. So if you're watching tonight and addiction has touched your family, we want you to know you're not alone. There is a solution, and it really doesn't matter how far down the scale you have gone, as recovery circles talk about, or what kind of disasters your families have seen.
That's right. And guys, maybe nobody's told you this before, but your family can heal. Things can get better, and real transformation is possible for the whole family.
That is so true, and we've lived that. We're living proof of that. So before we even begin tonight, tell us where you're watching from. Just give us a comment. And
if addiction has affected someone you love, let's type the word hope in there for us.
Yeah, awesome. Because we're here for you. We're willing to answer any questions that you want to toss out. And we got some things coming. One of the biggest problems in addiction, it's not just the drugs or the alcohol,
Right.
The using part of addiction or substance abuse. It's these lies, these false beliefs that people begin to live by. The addict believes them. Our family members believe them.
And families begin believing things like nothing's ever going to change. If I love them enough, they'll stop. A lot of people think that.
Mm-hmm.
I have a lot of family members that think maybe this is just not for them. Maybe my loved ones this is how it's going to be. This is as good as it gets. And they're even scared if they set boundaries, will I abandon that person? And we experience this from being here in the residential part, is recovery should be faster. Why isn't my loved one getting better?
That's the crazy part, and I can remember thinking that too early in my recovery journey.
Absolutely.
Because it's so easy to think of addiction and recovery like it's just the next thing to do, like you're just enrolling in the next class, or you're starting a new job, or you're getting a new bicycle, or whatever it is. And it takes a while to really recognize the significance of the sickness of addiction. So early on, we start thinking, as soon as we start feeling better, we start thinking, oh, shoot, I'm good. I feel better. I'm good to go. Not recognizing that we've been sick for a very long time, and it's going to take a very long time. Not to be back at a great place, but it's going to take a long time to completely rebuild everything. The good news is the peace and the joy and that sense of self comes pretty early on in the process if we'll stay consistent with it. And that's the same thing for family members. So tonight we want to challenge any of those false beliefs that you might have, and I'm going to throw some out. So even if you can't think of some, you probably recognize some.
Yes, let's. I've got to ask you guys. A question for yourself. I'm sorry, but what false belief has your family told yourself?
Yeah, maybe like the fear of something fearful, or I think the one I hear the most often, especially as maybe a parent or a family member, to believe that it's all my fault. It's all my fault that whatever our adult child is struggling with substance abuse because when they were 12 they wanted to play soccer so bad but we wouldn't let them, and if we'd only played soccer, they've never been the same since. And that's a really big one among family members, because I think especially mama bears,
Yeah.
they want to just kind of pick apart the history and try to figure out what was that period in life where mom made a mistake or dad made a mistake and now all that has ensued is all their fault. Well, that's a lie. That's not true. That's not how addiction works. um, Drop a word in the comment if you can relate to any of those. Was it fear? Was it guilt? Maybe it still is. Maybe shame. You feel shame because you haven't been able to do enough for your family member. Hopelessness. Chet, we're going to dig into the comments here in a minute. So feel free to ask anything that you want, but I'll introduce us. I'm Miles. This is my wife, Tina. We founded and still operate to this day a recovery program called Justin's Lighthouse Recovery. And Justin was my little brother who died from a drug overdose many years ago. And he had just graduated from a traditional clinical treatment program and was dead 2 weeks later from an overdose. And we didn't understand how that could possibly be. So we've literally dedicated the last 25 years of our life to studying addiction, what really works, what doesn't, why mainstream. And if you guys are familiar with our channel, you've seen some of my videos, and I'm not real nice about when it comes to mainstream addiction because it's failing all of us. But that's our focus, and we've been doing it for professionally for 20 years now. And I think one of the ingredients to our success is that we've always included the whole family dynamic in the process of recovery. So even though the patient, the addict, may be in our residential program, we're including the families throughout the process. There's been a lot of cases where we've worked with family members months before their loved one even finally agreed to accept help. But in those cases, when the families are involved that seriously, it's 100%. And I know that sounds crazy, but it's 100%. 100% of the time when the families get involved, their loved one always makes it. But when we've tried all these old strategies that don't work, it's so easy to give up.
Right.
It's so easy to say, oh, we've tried everything. We did this and we did that. Well, we're here to tell you, you may feel like you've tried everything, but you haven't. As family members, we try a lot of things, but so much of those are the wrong things.
Right. When we don't teach people just how to get sober here, we teach families how to have a true transformation, the transformation that comes from within, the transformation that God is able to give you. And we teach families and their loved ones how to work on their mental health, their spiritual health, their physical health, working on those 3 different things in your life and really getting honest with yourself about the problems that you're facing is going to be huge, and we'll see true transformation. But it takes time.
It does take time and commitment and consistency and hope and a trust in a process that sometimes it's hard to trust in. But
Right.
So how many people watching right now are in that place of exhaustion from just trying to fix everything? Or maybe you've been trying to fix everything, just to be on, type in me. And do we have any comments we need to respond to? If anybody's asking us any questions, There's no questions?
Yep.
We got no questions. Okay.
Not that I see yet.
Okay, well, we're going to keep on teaching then. The
And we want you guys also to remember, being tired is not the same as being weak.
No,
There's a difference.
There's a huge difference. I think one of the probably the biggest way, and this is like anything, it's not just addiction. Stress drains you. So exhaustion is going to wear you thin.
Right.
And so anytime you're just stuck in this cycle of trying to do this and trying to do that, and it's not working out, whether that's addiction or trying to, complete a task at work or whatever it is mentally exhausting. And when we're mentally exhausting, we become physically exhausting. And of course, in when it comes to recovery and addiction, when we've, as family members, when we're just reacting emotionally, oh my God, there's a new crisis today. Oh my God, the other shoe is dropping. Oh my God, there's this, there's that. You're going to spend your life exhausted,
right,
and worn out.
And I see when I talk to families, because I get the privilege of talking to families first when they contact Justin's Lighthouse, I see families that are living in survival mode. They're like Miles said, they're scared to see what's going to drop next, what's going to happen next. So when we give them some hope, it's refreshing.
When something bad happens or there's some crisis or some perceived crisis, then everybody just reacts emotionally. And I think, it's instinctual. It's not necessarily a bad thing. Of course, we're going to run to the aid of our addict loved one, but when that's all we're doing is putting out fires and rescuing and making everything feel better, if that's where we stop, then you're going to live in this state of chaos. You're literally going to go from one crisis to the next. So let me ask you this. Anybody who's watching, how many times have, in your experience with your maybe addict or your substance abuse loved one, alcoholic, whatever, how many times have you said, this is the last time? I can't do it anymore. This is the last bill we're going to help pay. This is the last ER trip we're making. This is the last rent we're going to pay. This is it. But then pretty quickly, things just went right back to chaos. And we do it again, right? That's one of the things as family members, we keep saying no, but we keep doing it. We keep saying no, but we keep helping, we keep helping, we keep helping. But that's the difference between help and relief. We're not really helping. We're just offering relief.
And we're going to be talking about principles that are going to change everything for you guys.
Yeah. So the primary difference between help and relief is offering relief is just about helping everybody feel better. So it's a quick fix. It's, oh my gosh, they're stressing because they spent all their money on booze and now they can't pay their rent. So as family members, we swoop in and we write the check and we pay the rent, and we've offered relief and everybody feels better, even though our alcoholic says, oh man, thank you so much. I'm never going to do that again. I'm never going to go back. But until change occurs, they will always default back. That's the science of addiction.
Right.
And unfortunately, that doesn't really get addressed in mainstream media, regardless of what they say. But real help affects real change. And real help comes with boundaries. Real help comes with accountability, with personal responsibility. And during the cycle of addiction or just the sickness, it's really up to the families to be implementing that, because the addict's not going to. The sick person or the patient, they're just going to keep doing what they can get away with. It's really up to the families to learn these kind of strategies and start implementing them.
Yeah, let me ask you guys a question. How many of you families have helped financially, let's say pay a bill, maybe covered up a problem that your loved one was having due to their addiction, rescued them even from consequences, from having to have any consequences at all, because you were scared of what would happen next?
Yeah, and no judgment. We've all been there. We've all done that.
Absolutely.
That's an instinct that humans tend to have. It just doesn't work with an addict brain.
Right. And that's why a true transformation matters. It's when we become honest with ourselves and with others that are helping us, through the process. That's when things start changing. and it starts happening. How many of you feel exhausted and you're just tired right now? You're emotionally drained. On a scale of 1 to 10, how many of you can say that's where you're at?
Yeah, yeah. So, yeah, on 1 to 10, put that in the comments. On a scale 1 to 10, where are you emotionally tonight? Let's talk about why some of these normal strategies don't work. Logical and rational strategies don't work in addiction because addiction, not just addiction, addiction and trauma has rewired the brain. So all these pathways in our brain are misfiring, and parts of the brain that should be communicating in healthy ways aren't. And so healing starts in the brain. It has to become rewired. But the way that happens is we change behavior. Now think about this, and of course this is very consistent with all 12-step programs and any kind of recovery program. We are taught change behavior, do the next right thing. Right? It doesn't say feel the next right thing. The saying isn't think the next right thing. It's do the next right thing. It's behavioral. And the reason is because that's the one thing as humans we can control. And so when we're willing to put ourselves in a position to learn how to behave, here is what you should do next, and then what you should do after that, and what you should do after that, routine. As we fall into that and we become willing to follow in our behavior, it literally rewires the brain through this process called neuroplasticity. It's the same process that made the brain sick. It's the same process that will make the brain better.
Hey guys, I know there's a couple of you that are watching, and we really appreciate you supporting us and just listening to us.
Absolutely.
Somebody asked, "Can you be addicted to weed?" So I'm gonna let you answer that.
Absolutely, yes. We're in Oklahoma City. Oklahoma is a medical marijuana state. We deal with this all the time. Um, I'm actually a very big proponent of medical marijuana. I'm not a user in any way. I've been sober for 23 years now, off everything. But it depends, yes, absolutely. At the very least, you're physically dependent. There's no doubt about it. If you quit, depending on how long you've been using, if you were to stop using, I'm assuming you've been using for a while. If you were to stop using, you would have withdrawal symptoms. Now, are you self-medicating? Are you treating a mental health disorder? And that's what we see a lot of now. I would like, because a lot of people do have mental illness. I would much rather see a person on medical marijuana treatment than, say, some of these hardcore psychotropics that we see. And then we've worked with these people that have been on some pretty heavy duty stuff for 15, 20, 25 years, and they're not getting better. I have personally asked many times someone that would check into our residential program, and they would check in with multiple prescription meds, and they would say, "Oh, that one's for anxiety, that one's for anxiety, that one's for anxiety." And I always ask, "Wow, that's a lot of anti-anxiety meds. How long have you been taking those?" And they would always say, "Oh, 10 years, 15 years."
A long time.
Okay, but you still have anxiety. They're not helping. But what we do see with people who have like a clinical diagnosis, whatever it is, chronic anxiety, appropriate doses, here's the kicker, appropriate doses of medical marijuana has a far greater impact than some of these hardcore, I can't say that word, will probably get blocked, but medications. I'll just leave it at that. So yes, is it something that you're wanting to do anything about? That's really the bottom line. And here's a good perspective that all of us should use when we're looking at any kind of behavior that we're questioning. Is it I ride my bicycle every day 20 miles. Is that bad for me? Well, is it keeping you from living up to your responsibilities? Is it putting you in a position where you're beginning to slack, or it becomes more compulsive, or that's all you want to do? And we can kind of drift slowly in that direction, not realizing. And then we wake up one day and we realize, oh, wow, I just lost a relationship. I've lost my car. I've lost my job. I've lost. My self-esteem went away 6 months ago. It can be a very slow, grinding process. So we got to be honest with ourselves when you answer that question, because it's easy to say, oh, no, 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 it's not bothering me at all. I just drink a couple on the weekends. I just drink. But if it starts impacting your relationships, you might want to take a look at it. But here's the thing. If it's impacting the relationship you have with yourself, is it helping you to be the best you can be, or is it preventing you from being the best you can be?
Right.
And being honest with yourself about that stuff, that's everything.
That's what we were talking about earlier. You know,
Yeah.
you got to be honest with yourself and really take a look at it and see where your life is at
Yeah.
and where you want it to be at. You know, are you happy with where you're at smoking pot? You know, just you got to be honest with yourself and look at it.
Yeah. Yeah, no, and no judgment,
No.
no judgment from us. Hey, talk about these steps.
Okay, yeah, let's talk about that. There's 5 practical steps that we want to help your families with. Identify the belief. What story are you telling yourself that may be keeping you stuck? Is my loved one never going to change? We've tried everything before and that hasn't worked. You know, we're on our 5th, 6th, 7th, 8th treatment center and it's not worked. It's not going to work.
Yeah, we hear that one a lot. Well,
lot.
treatment doesn't work. I just did a video on this recently, or something like that. Wrong treatment doesn't work. Right treatment always works. And unfortunately, we've been taken over by big corporate firms that are controlling the treatment industry. And so most of the treatment out there ends up being wrong treatment. But there are absolutely right strategies that are 100%, and especially when the families get involved. So what would be a good step 2?
Question the belief. Is it true?
Is it?
Or is it fear talking?
Yeah. Treatment, let's use that one as an example. Well, treatment doesn't work. Well, what are you basing that on? Well, we sent little Johnny to this rehab and that rehab and this rehab and that rehab, and it didn't, and those things didn't work, so no treatment works. Right. But in reality, those treatments were all very similar. They were probably most likely very short term, which was only when I say short term, I mean 30 days, which is only just enough time to detox. In fact, they've even done studies on this. When a person goes to 30-day treatment, they spend the first 2 weeks detoxing. Right. The 3rd week, they're kind of coming out of their shell and starting to pay attention. And then they spend the 4th week worrying about what they're going to do when they get out in 7 days. Yeah. That's not treatment. That's just a 30-day break.
Right.
It's just not enough time to do any kind of digging or processing.
And when I went to treatment, you know, those 30 days, they were real hectic. It wasn't, you know, like I was on a vacation time.
It's go, go, go.
Yeah, it is. It's go, go, go. It's you can't take a nap when you need to. You know, it's just they've got some really strict things that you have to go by. I'm glad we don't treat our clients like that.
No.
You know, we treat them like humans, and we treat them with the respect and love we want.
Yeah,
and we do for ourselves.
If you're tired, then you need to be resting.
Yeah.
And of course you're tired. You just quit using meth 7 days ago.
And you've been using it for 15 years, so of course you're going to need rest.
Right. That's,
you know,
the common sense stuff that is devoid in mainstream treatment. But you know, they got to get those billings in. If you don't show up at that 7 a.m. thing, man, they can't bill it and they'll kick you out.
That's true. So let's go to step number 3. Look for times when you had hope. Has there ever been a moment of hope in your family situation? And if there has, you got to grab those times.
Yeah, that's a good place to kind of reach back to, if you can remember it.
Right.
I know for a lot of us, maybe you've been in the grind for so long trying to help your loved one, and maybe it's you. Maybe you're the loved one in the family that you're just as frustrated and afraid and feeling hopeless as your family members are. It's so easy to get caught in that cycle of no hope. But that's one of the reasons why we wanted to go live tonight, was to offer a little bit of that, because it really doesn't matter what you've been through. I'm telling you, right recovery systems do work. We see it every day.
I like step number 4, and before we talked about this, we were kind of saying,
Yeah,
uh,
this is how it happens.
yeah, you have to create a new narrative, and you have to tell yourself transformation is possible. And
you don't know how, you don't have to know how it's possible. That's what keeps us stuck. And the addict brain is well equipped to overthink. So it's easy to say, well, yeah, transformation is possible, but how is it possible? And we'll get hung up on all the ways that we can't see how it's possible, so we'll just reject it.
right.
But what if it is possible? We just don't know what that is yet, but we could learn it.
And that's what, when I talk to families, and when I talk about this transformation and that's this narrative, or that they can have this totally different life. And by the time they hang up with me, they agree. We really talk about it, and we say, yeah, life can be different, and a transformation can happen.
Change the narrative.
And it's about for the whole family too, not just their loved one. They're excited to finally have a normal life again and not have to always be focused on just the person has the addiction, but the whole family heals. And that's what's awesome about it.
I want to elaborate on that for a minute. Why is that so significant? Well, here's the thing. In addiction, in the family dynamic, the addict, the substance abuser, whatever, is referred to as the identified patient. So basically the spotlight is on the addict. And the addict is running around doing their thing while the family members are running around chasing the addict. The addict becomes the drug for the family, and all the sickness that entails, or that ensues from that. So what tends to happen is, if the addict goes in and seeks recovery on their own, they literally become the most healthy person in the family dynamic. The family members are still left in their codependency, in their enabling, in their crisis building, in their need to rescue, their need to over rescue, their need to put all the fires out, to fix all the problems. Well, when the addict no longer is a problem and is solving their own problems and is developing their own independence, Mama Bear doesn't know what to do.
Absolutely.
Or Papa Bear doesn't know what to do. And, my mom, after my little brother died, I had a lot of conversations with my mom about this. And she said that was the most difficult part, is not waking up every day and thinking, okay, what does he need me to solve today?
Right.
What does my loved one, my addict, need me to fix for him today? Well, when the addict gets better, or in Justin's case, dies, then there's nothing left to fix. And so our family members will create their own crisis. That's why it's so critical for everyone in the immediate family to take the entire recovery process seriously. Even though, I know it's easy to say, oh, we're not the one with the problem. Well, yeah, that's just not true, because it's impacted everybody. And of course, the more you deal with them mostly on the phone,
absolutely,
and I deal with them in person. And after you've explained to them, look, and you can point out, you need help in this area, you need help in that area, they usually recognize that.
Absolutely.
And so it's
they're
tough.
wanting it. They're wanting to be able to sleep at night. They haven't slept all night long in years. I had mom tell me that once. For the last 13 years, she's always woke up in the middle of the night several times worrying about her daughter.
Yeah.
So after her loved one had been here for about 6 months, she's like, I finally slept at night, the whole night long. And I'm like, wow, that's exciting. It's just those little wins that the families get excited about.
Just like the addict, without the drug or the alcohol or whatever the compulsion is, it's not just substance abuse. Whatever that self-defeating compulsive behavior is, when we no longer have that, we have to learn what to do now with ourselves, with our life.
Yeah.
It's the exact same thing with our families. Well, when they don't have us to fix anymore, they literally have to relearn how to live their own life apart from that.
There's one thing that I really like seeing too. This is the mom and dad. They start having this awesome relationship again. The addiction in the family has really torn them apart.
Mm,
Maybe
mm.
mom is a little bit more softer, and dad wants to be stricter, so it causes some division in between them, and that's always can be not good. But when they start coming on the same page, when they start getting on the same page, that relationship starts to heal. And that's what transformation is about.
How
It's about
amazing.
healing
Yeah.
the trauma
Yeah.
that's inside of us. Just imagine that, not having that trauma anymore inside of you,
Yeah.
and being able to be transformed and having a different life. And that's the beauty of recovery. But recovery takes repetition, and you have to practice it every day, every day, every day.
Every day. It's so easy, or I think it can be very difficult to even think along those lines because we've adapted. The addict has adapted to kind of, we'll say, whatever, mediocrity. The family has adapted to just accepting the way things are. And so, just like the addict has to get kind of rebuilt up, the families do too. So if you're watching and this is of any interest to you whatsoever, give us a comment and type these words, because maybe this will be the first time. Maybe this will help you with a mental adjustment. Type in "change is possible." Change is possible.
There's a couple of people that said hi to us, and I want to say hi back.
Hi,
Somebody asked, "Do you like Costco's rotisserie chicken?"
love it,
Love it.
love it.
I love their chicken salad too. That's another bomb item there that I like.
The best thing you do with that is turn it into chicken and dumplings.
Yes,
That's a big one.
I make chicken and dumplings. That are
Yeah,
the bomb. Everybody
yeah.
loves them when I make
With the,
them.
with the rotisserie chicken. See, it's amazing. In recovery, you actually have time to be able to do little things like cook dinner
Yep.
with stuff you got at Costco. That's how that works. So anyway,
And families, what I like about it is that families start to stop reacting emotionally,
yeah,
and they start
yeah,
thinking strategically. They stop reacting that way.
yeah.
It's
That's
huge.
But we have to learn how. We have to learn how. And that's the biggest thing, and when I say we, I come from the perspective of an addict. I also come from the perspective of a family member of an addict. I'm the spouse of a recovering addict. I'm a recovering addict. So, because we've literally been on all areas of this, all four corners of this thing, I think we have a very unique perspective. So what we're telling you works. It absolutely works. And what needs to happen in the beginning is we just have to believe that it could work. Because we start from so far down, it could work. And I'll tell you, I'm gonna really open something up to you, because if this is of interest to you, and it should be, I don't think you've been watching. You wouldn't have hung in there if you weren't interested. I want to invite you guys to join us. We've got a live event coming up, and it's called Breaking Free from Addiction. And what we're going to do there is we're going to get in depth about the lies that keep families stuck. We're going to describe exactly what's happening in the addiction process that will help you to better respond to your family member. Or if you're the patient, if you're the one stuck in addiction, it will help you to respond to yourself and your problem in a different way. We're going to help you identify what trauma really is and how to heal yourself with new information. We're going to give you instructions on how to implement boundaries without disconnecting from your loved one, and give you some real strategies. In fact, it's the same strategies that we've been using straight from our 20-year recovery program curriculum that will always move your addict closer to recovery and stay there. But you have to follow the instructions. So here's what I want you to do. Go to our link in the bio. It's the first link. Click it on. It's going to take you straight to the Breaking Free from Addiction site, where you're going to get two things. It's going to get you registered, and it's also going to give you a free ebook called Breaking Free. I think it's one that we sell for $27. You can get it for free right now. Go to the link in the bio.
And coming to this event that we're talking about, this live event, it's going to be life changing. You know,
Big
you're
time.
going to hear
Big
things
time.
that you've never heard before,
Yeah.
and
Yeah.
you're going to be able to heal, like we've
Yeah.
been talking before already. We also talked about sleeping at night. You know, you're going to be able to
Sleep again.
again. So there's all these little things that are going to be
Do
big
things
things that
again.
are going to you're going to be able to do.
Play golf again. Get your hair
Yes.
done. Go to the nail shop. Hang out with your whatever.
If you know anybody who would benefit from hearing what we are going to be talking about, send them our link, or we also have your email on there.
Yeah.
My phone number's on there. You guys, if y'all need us, call us. And we really, really appreciate you watching tonight. And like I said, we really appreciate all the comments and the support that we've got.
Yeah.
We would ask you just one more thing. We want you to like the video, share this live, and subscribe to our channel. And send this to somebody who maybe needs some hope.
Yeah, seriously, you know how serious this topic is, and we're very serious about what we do. So please support our channel, and we'll give you as much value as we possibly can.
Absolutely.
And all you have to do is just comment in one of our videos exactly what you would like some more information on, and we'll do a video on it, or we'll even reach back out to you directly if you've got something in particular going on in your life you need help with. So we're going to end it for tonight. Thank you guys so much for watching.
Thanks, guys.
Go click that link in the bio and come to our live event. Thank you.
Good night.
Now I got to go turn it off.
That's the weird part.
We're using my phone, so I got to get up. Okay, thanks, guys. We really appreciate you.